Welcome to the State of Montana Benefit Plan, or State Plan, New Employee Benefits presentation. This presentation is a supplement to the New Employee Benefits book you will receive in the mail from the Healthcare and Benefits Division, or HCBD, upon starting your job. You can access an online version of the New Employee Benefits book at any time by clicking on the Healthcare and Benefits Division logo on each slide. We highly recommend you carefully read the New Employee Benefits book to gain an understanding of the benefits and the choices available from the state plan. You can visit the HCBD website at www.benefits.mt.gov at any time during the presentation by clicking the link. And if you have any specific questions that are not covered during the presentation, please email or call the Healthcare and Benefits Division at 800-287-8266. or for TTY assistance 406-444-1421. The State of Montana Benefit Plan is self-funded. The funds that pay for the plan member expenses and benefits come from two places. The first is the employer contribution. This is a per-month contribution paid by the State of Montana on behalf of each employee. The amount is set by legislature and funded by income from state taxes. The other place money comes from is you, the plan member. Your monthly benefit contribution is calculated based on who is enrolled in your plan and which optional benefits you've selected. The expenses for the plan happen when you go to the doctor or the dentist or fill a prescription, medication. A bill is then sent to one of our third-party administrators, or TPAs. The state plan contracts with these TPAs to process and pay claims based on the benefit design and the coverages of the state plan. A small amount also comes out of the state plan to pay administrative costs like HCBD staff salaries and contract fees for the TPAs. Administrative expenses represent a very small amount of our yearly spend. Any remaining funds are used to pay plan reserves. Plan reserves are used to offset and save for unexpected costs of the state plan that may be responsible for, such as federal or state regulatory mandates and larger than expected claim costs. In order to take full advantage of the state plan benefits, you will need to enroll in benefits within the first 31 days of your date of hire. If you enroll in benefits within 31 days of your date of hire, your coverage will be effective as of your hire date. As a new State of Montana employee, you will be notified via email when the enrollment system is available for you to enroll in the benefits. Please watch your email for this very important notification. If you have any questions or concerns, please contact the Healthcare and Benefits Division. If you miss the initial enrollment period, you automatically waive your coverage. As an employee, you can enroll in core benefits after the first 31 days, and your effective date will be dependent on when you enroll. But you will then miss out on enrolling in optional benefits offered, such as dependent coverage for medical, dental, and vision hardware, life insurance, dependent life insurance, long-term disability, and flexible spending. If you do not enroll within 31 days of your date of hire, you will only be able to add dependents to your benefit plan during a special enrollment period or during the annual open enrollment period, which occurs for 2 weeks each fall. When an employee enrolls in benefits, they must enroll in core benefits. Core benefits include medical, which also includes the prescription drug coverage and coverage for one annual eye exam, dental, and basic life insurance for the employee only. This slide shows the cost of the state plan coverage for medical, dental, and vision hardware benefits for yourself and any dependents you wish to enroll on the state plan coverage. The employer contribution amount is $1,054 per employee per month. As a new employee, you will have the opportunity to participate in the Live Life Well incentive program and earn an incentive towards your monthly benefit contributions for the following plan year. Watch for important information regarding how to earn the Live Life Well incentive. And see your new employee benefits book or visit the HCBD website for more information. You have optional benefit choices as a state plan member. You have the option to add a spouse or domestic partner and or dependent child or children under the age of 26 to the medical, dental, and vision hardware benefits. If you enroll a spouse or domestic partner and or dependent child or children, you will be required to provide documentation upon enrollment which verifies their eligibility as your qualified dependent. You may also be eligible to enroll in optional benefits like flexible spending, extra life insurance, and disability insurance. See your new employee benefits book or visit the HCBD website for more information regarding optional benefits. Listed on this slide is a summary of the copayments, deductibles, and benefit percentage amounts for the medical plan. Although deductibles and maximums will be based upon a plan year, which is January 1st through December 31st, please review your new employee benefits book, pages 10 and 11, for complete details on medical plan costs. As a state of Montana plan member, you and your covered spouse or domestic partner and or your child or children receive medical benefits as defined by the state plan. In addition to the medical benefits, you each receive one annual eye exam with a $10 copay at a participating provider, prescription drug coverage, and the use of all Montana health centers at no cost. Allegiance Benefit Plan Management processes the medical claims for the state plan. Cigna processes the out-of-state claims and the vision claims for the state plan. Navitas Health Solutions processes our prescription drug coverage benefit. And remember, it is the state plan that decides the rates, the out-of-pocket costs, and coverages. Remember, you will receive an identification card in the mail from Allegiance, Cigna, and Navitas Health Solutions. If you use a non-participating provider or facility in Montana, you pay the cost sharing shown previously, and the state plan will pay a fair rate for your care. But the non-participating provider may balance bill you for more. You are responsible for this balance bill, and it does not count toward your deductible or your maximum out-of-pocket. It is important to check participating member status. If you use an out-of-state, non-participating provider or facility, the cost sharing is shown on this table. Remember, these amounts are separate from the deductible percentage and the maximum out-of-pocket for participating and non-participating providers and facilities in Montana. Employees and covered dependents over 2 years of age who are also covered by the state plan can use any of the Montana Health Centers. The state plan has health centers in Anaconda, Billings, Butte, Helena, and Missoula. Non-Medicare eligible retirees and their non-Medicare eligible dependents can use the Montana Health Centers for all services. Medicare eligible retirees and their Medicare eligible dependents can only use the health centers for flu shots and health screenings. The Montana Health Centers are much more than urgent care. You can make a Montana Health Center doctor your primary care provider. The Montana Health Centers provide the same kind of services that regular doctors' offices provide. If you already have a primary care doctor, you can still use the Montana Health Centers for no-cost physicals, health screenings, lab work, vaccines, and more. Call and ask the Montana Health Center if you have any questions about what kind of services are available. You may click on the logo to access the website for the Montana Health Center. The Montana Health Centers are operated by a company called CareHere. The state plan pays 100% of the cost associated with the care plan members receive at the Montana Health Centers. That means any service you get at the Montana Health Center is paid in full by the state plan. You never get a bill. However, please be aware that services received outside the Montana Health Center will apply to regular state plan benefits, even when a Montana Health Center provider makes your referral. Navitus Health Solutions is the state's plan pharmacy benefit manager. With Navitus, you have a retail network pharmacy 34-day option for filling prescription medications, as well as a retail network or a mail order 90-day option. Lumicera is the preferred specialty pharmacy for specialty medications. You will want to visit www.navitus.com to get information regarding state plan's participating network of pharmacies, as well as review the formulary, which is the listing of covered medications, and the tier in which they are covered. Here's a look at the prescription drug plan copay structure. Notice that if you are on a maintenance medication or a medication you take every single day, you save money by using the 90-day fill option, as you receive 3 months of medication for just 2 copayments. $0 preventive products are certain preventive medications that are either $0 at retail, a 34-day supply, or retail mail order 90-day supply. Tier 1 are preferred generics at some lower cost brand products, which are $15 for a 34-day supply and $30 for a 90-day supply. Tier 2 medications are preferred in brand products at some high-cost non-preferred generics that are $50 for a 34-day supply and $100 for a 90-day supply. Tier 3 are non-preferred products and some high-cost non-preferred generics, and these are paid at 50% coinsurance for either a 34 or 90-day supply. And that coinsurance that you pay does not apply towards the maximum prescription out-of-pocket amount of $1,800 per individual and $3,600 per family. Tier 4 medications are the specialty drugs provided by Lumicera, the preferred specialty pharmacy, and they're a $200 copay. If you get your specialty medications from a retail network, non-preferred specialty, or an out-of-network pharmacy, there's a 50% coinsurance, which again does not apply to the maximum member out-of-pocket. You have the choice to fill your maintenance medications and get a 90-day supply at a local in-network pharmacy or at any one of the state plan's participating mail order vendors. Costco, and you do not have to be a Costco member, MyRx, or Ridgeway. When filling a 90-day supply of medication, you can get a 3-month supply of medication for just 2 copays versus 3. Please consult your new employee benefits book for details or visit the HCBD website for more information on the prescription drug plan. The prescription drug plan has a separate maximum out-of-pocket from the medical plan. The maximum out-of-pocket for the prescription drug plan is $1,800 for an individual and $3,600 for a family. Remember, Tier 3 and Tier 4 coinsurance amounts do not apply toward this prescription drug plan maximum out-of-pocket. The maximum out-of-pocket will be based upon a plan year of January 1st through December 31st. Delta Dental is the TPA that processes the state's plan dental claims. Remember, it's the state that decides rates, out-of-pocket costs, and coverages. Delta Dental provides members with 3 network options: preferred provider, premier dentist, and non-network dentist. Choosing a preferred provider results in you, the plan member, paying the least. Contact Delta Dental by phone or online to ask questions about claims, billing, request a cost estimate, or check the network status of your dental provider. You can also refer to the new member benefits book or the HCBD website for more information on the dental plan. This slide shows the reimbursement amount set by the state plan for dental services. The state plan pays an annual maximum of $1,800 per enrollee per calendar year. The dental plan applies a $50 deductible per enrollee or $150 per family per plan year to basic and major benefits. Please note, the diagnostic and preventive benefits are not subject to the deductible. The Vision Hardware Plan is an optional benefit elected by the member. When electing the Vision Hardware Plan, be aware that any dependent, which is spouse or domestic partner, and child or children that you cover on the medical plan will also be enrolled on the Vision Hardware Plan if you elect it. And remember that every member covered on the medical plan receives 1 routine vision exam per year for a $10 copay. Then, if you add the Vision Hardware Plan, that provides some reimbursement for frames, lenses, contacts, and specific add-on features for your glasses. You must re-enroll in this benefit every year during open enrollment. Review the details of the Vision Hardware Plan in your new employee benefits book or on the HC. You are eligible to elect to participate in a medical and a dependent care flexible spending account. The flexible spending accounts are administered by Allegiance Flex Advantage. As an employee, you can set aside up to $2,600 for medical-related expenses. You have the ability to roll a maximum of $500 from medical flex money over to the next plan year. This money is for qualified medical, dental, and vision expenses for you and your dependents. Check Allegiance's website to see a full list of qualified medical expenses. Dependent care flexible spending has a maximum contribution limit of $5,000 per calendar year. This money cannot be used for medical expenses. Dependent care contributions must be used to pay for charges associated with child care, for children under the age of 12, or for qualified disabled dependent care while you're working. For more information on flexible spending account options, refer to the new employee benefits book or the HC. If you elect to participate in one or both types of flexible spending accounts, you will be charged a $2.26 per month fee for the administration associated with the flexible spending accounts. FSA reimbursement options include electronic submission through Allegiance, paper form mailed submission, debit card, which includes a $1 per month fee, or joint processing, which must be re-elected annually. Joint processing means that when your flexible spending account eligible claims process for benefits through Allegiance, then the claims will automatically process to your flexible spending benefit and reimburse you directly for your out-of-pocket expenses as reimbursement. You may choose debit card or joint processing, not both. For more information regarding flexible spending accounts, please click on the HCBD website. This slide shows the monthly out-of-pocket cost for the optional benefits of adding life insurance for you, the employee, and your spouse or domestic partner and/or child or children. Also listed are the monthly costs for accidental death and dismemberment, or AD&D coverage. And at the bottom, you will see the monthly cost for the long-term disability coverage. Every employee who enrolls in the state plan is required to enroll in the basic life insurance benefit. The basic life plan is paid for by the employer contribution and gives you $14,000 of coverage. As a new employee, you may elect to participate in the optional employee life plan at an amount equal to your annual salary within your first 31 days of your date of hire without completing an evidence of insurability, or EOI. You may elect optional employee life coverage at any time up to $500,000, but anything over your annual salary amount, and including your annual salary if not in the first 31 days, is subject to EOI. The optional spouse life plan is available if you have elected optional employee life. Coverage is available in $10,000 increments and is available up to the amount you elected for optional employee life. Any amount elected over $10,000 is subject to evidence of insurability and including the $10,000 if not elected in the first 31 days. As a new employee, you will also be eligible to enroll in dependent life. You may only enroll in dependent life during the first 31 days of your date of hire, or within 60 days after getting married, or within 91 days of the birth of your first child. If you do not enroll during these times outlined, you will not be eligible to enroll at a later date. Accidental death and dismemberment, or AD&D coverage, is available within the first 31 days of hire. It is not subject to EOI. If not elected within the first 31 days, it may be elected at any time. With the exception of basic life and dependent life, all other benefits may be increased or changed during the open enrollment or at any time with evidence of insurability, or EOI. These benefits are provided by the Standard Life Insurance Company. Every employee has access to guaranteed long-term disability, LTD insurance, in the first 31 days of hire. If you do not enroll in LTD coverage within the first 31 days of your date of hire, you must wait till open enrollment to sign up, and if you will be required to complete an evidence of insurability and then be approved for coverage. The coverage is $9.90 a month and provided by the Standard Life Insurance Company. In the event you become disabled, the insurance would replace approximately 60% of your pre-disability wages starting 180 days after you become disabled. You have the opportunity to earn a $30 per month discount off your 2019 benefit contribution by completing 3 activities. You complete a state-sponsored health screening, being nicotine-free, or if you're not nicotine-free, completing an alternative, and completing and self-reporting an eligible next step activity. You may double your incentive if a covered spouse or domestic partner on the plan also participates and completes all 3 activities. Remember, all 3 activities must be completed to earn any incentive. Partial incentives are not available. You must complete all 3 activities between November 1st of 2017 and October 31st of 2018 to be eligible for any incentive in 2019. On these next slides, we will go over each of these 3 activities in more detail and provide instructions for earning the incentive. To earn your incentive, we recommend that you schedule a state-sponsored health screening as soon as possible. You have 2 ways to access a state-sponsored health screening. It depends where you live. You may either choose a day during the year that works for you and schedule an appointment for a health screening at any Montana Health Center in Anaconda, Billings, Butte, Helena, or Missoula. Or, if you can't make it to a health center, we send a team from the Montana Health Centers around the state each year, and these are called off-site screenings. The schedule for all off-site screenings is posted and ready for appointments starting each year in mid-January. Appointments can be made at the health center any day that works for you, or you may find the full schedule of off-site screenings and the instructions for making a health screening appointment at http://healthcenter.mt.gov/health screenings. You may click this link and visit the schedule and make an appointment. Included in your state-sponsored health screening is a height, weight, and blood pressure measurement. You may also have a waist circumference taken, but that's an optional and upon request only. Your blood will be taken and a complete blood count, comprehensive metabolic panel, and a lipid panel will be run. If you have other tests that you would like to add, at the time of your screening, you must bring doctor's orders or prescription for these tests. Most tests can be added with the prescription at the Montana Health Centers. However, if you attend an off-site event, you may only add PSA, TSH, or HbA1c. Please bring your prescription, as health center staff cannot complete any lab tests in addition to those listed without it. As part of your earning of the incentive, members must also self-report that they are nicotine-free, or if they are not nicotine-free, that they have completed an eligible alternative. There are two eligible alternatives: either completing a nicotine cessation program or attending a nicotine education session. You then self-report your nicotine-free status or the completion of an eligible alternative at www.myactivehealth.com/SOM. We'll go over the instructions for self-reporting shortly. The first alternative is the completion of a nicotine cessation program, and you may complete any nicotine cessation program, but we at the state have two available programs to state plan members at no additional out-of-pocket cost to you. The first is available to members who are able to visit the Montana Health Centers. The second is available to anyone who lives in the state of Montana, and it's the Montana Tobacco Quit Line. The second alternative is the completion of a nicotine education session. This is simply a visit with your provider for the purpose of discussing your nicotine use or exposure. This is appropriate for members who are not ready to quit using nicotine or who are exposed to nicotine only rarely or via secondhand smoke. You can find more information about the alternatives here at www.benefits.mt.gov/nicotine-free incentive. To summarize, in order to be considered nicotine-free for this part of the incentive, you must not use any form of nicotine: cigarettes, chewing tobacco, pipes, cigars, vaporizers, or nicotine replacement therapy like Nicorette gum or lozenges. If you use any form of nicotine product, you must complete one of the two alternatives. As part of earning the incentive, members must also complete an eligible Next Step activity. This is a complete list of the eligible Next Step activities, and it is available for you at www.benefits.mt.gov/incentive. This slide is a little small, but it's intended to show you how many different options our members have to choose from for this activity. Remember, you are only required to complete and self-report one of these Next Step activities. There is a whole list of these eligible activities in addition to the options we detailed here. You choose and complete and self-report whichever one works best for you. You can find instructions for how to complete and check the status of all your incentive activities at www.benefits.mt.gov/incentive. To report your activities or check your status, you may visit www.myactivehealth.com/SOM, or you may call MyActiveHealth at 855-206-1302 for assistance with your account or the website. The state plan offers the incentive program to all plan members and their enrolled spouse or domestic partner. If you think that you may be unable to meet a standard of the incentive program, you might qualify for an alternative program or different means to earn the incentive. However, you must contact the Healthcare and Benefits Division, HCBD, as soon as possible at 800-287-8266 or TTY assisted 406-444-1421, or email benefitsquestions@mt.gov. We will then work with you, and if you wish, your doctor, to design a program with the same incentive that is right for you. We'll maintain the privacy of your personally identifiable information, and medical information that personally identifies you and that is provided through the incentive program will not be used to make decisions regarding your employment. Your health information shall only be disclosed to carry out specific activities related to the incentive program, such as responding to your request for a reasonable accommodation. You will not be asked or required to waive that confidentiality of the health insurance information to participate in or receive an incentive. Anyone who receives your information for purposes of providing you services through the incentive program will abide by the same confidentiality requirements. We securely maintain all electronically stored medical information that we obtain through the incentive program and will take appropriate precautions to avoid a data breach. If a data breach does occur that involves your information that provided to us for the incentive program, we'll notify you immediately. You may read a copy of the plan's privacy notice on the HCBD website. The Employee Assistance Program, or EAP, assists employees and family members by providing counseling service, 24 hours crises help, and many other life balance resources. Call the number on the screen or visit the HCBD website, www.myrvh.com. The access code is Montana, and access these very important benefits. Enrollment in the state plan is not required. For additional information, refer to the new Employee Benefits book or visit the HCBD website. Here are some ways that you can make the most of your state plan benefits. Doing these things saves you and the state plan money. Use participating providers and in-network pharmacies. Visit the HCBD website for links to participating providers, in-state and out-of-state, and in-network pharmacy directories. Review your medications. Some medications qualify for a 90-day fill at retail or mail-order pharmacy. Remember, when you fill 90 days at a time, you will pay only 2 copays versus 3 and receive 3 months of medication. Use the Montana Health Center whenever you can. The Montana Health Center provides primary care at no cost to you. Take advantage of the no-cost wellness and prevention programs available to you, and participation in these programs could reduce the amount of your monthly benefit contribution. And finally, be aware that vendors may contact you with informative, cost-saving programs for you to participate in. They will never solicit your personal information, and your decision to participate in these programs is optional. Open enrollment is a time each fall when the state plan provides information about changes in benefit contributions or changes in benefits coming for the next plan year. It is also the time to make changes to your benefits, like opting back into the Vision hardware plan or renewing your flexible spending accounts. Any changes you make are done online, and they take effect the following January. We encourage you to watch an education presentation to make sure you're up to date about any changes coming in your benefits for the next plan year. If you have any questions about eligibility, who is covered on your plan, mid-year changes, payroll deductions, or the Live Life Well incentive program, you should contact HCBD. If, however, you have questions about claims, bills, EOBs, your explanations of benefits, participating providers, individual account information, what's covered, pre-authorizations, or how to make a Montana Health Center appointment, you should be contacting our third-party administrators like Allegiance, Navitas, Delta Dental, the Standard, or the Montana Health Center. Refer to the back cover of your new employee benefits book for websites and contact phone numbers. Thank you for attending the new employee benefits enrollment training.